This is Crane Durham's Nothing But Truth.
Welcome back. Happy Monday. Hope you're doing well. Well, are you going to discuss Trayvon Martin? We'll talk about it, but we're going to bring Hans back to specifically address that and what is being ginned up or attempted to be ginned up. And that is when and if George Zimmerman is declared not guilty by the jury, they want some reaction that is destructive, and they want to show the divide between the races. I'll get to that. But first, I would like to go to what's happening to doctors across the nation. One doctor who said, look, I'm done. Here's a news report of a doctor who says, I can't keep going because the government is not paying me enough for the services that I need, and they're requiring me to take Medicaid patients. So here is this doctor in a news report from last week. Roll it.
I went into medicine to make a difference in people's lives.
But Dr. Robert McWilliams says he's going broke.
I haven't paid myself a salary since October 2010. It's the last time I took a dime home from my 40-year practice.
Medicare, Medicaid, and insurance companies are paying doctors less. Dr. McWilliams says for 2 years he's lived on his savings because it takes all his income to pay staff and run his office.
Dr. McWilliams sees more than 5,000 patients a year, and he'd hope to continue seeing patients for another 5 years. But he says the changes in the Affordable Care Act that are coming have been the last straw.
It's going to be run by bureaucrats, and it's going to be run by politicians who have no idea what is in your best interest. Then I'm getting out.
He's not alone. Other doctors are beginning to close their practices, worried about the Affordable Care Act, which goes into effect in January.
If you add millions of 20 million, 50 million Medicare patients to the system, but you have no doctors to take care of them, what good is the system? It's going to hurt me, but it's going to hurt the patients more. And the patients need to realize that.
And they are figuring that out. Now, I bring this because I want you to know that whatever you have seen about the Affordable Care Act, there are consequences to passing a legislation that is written like this and puts the power in government bureaucracies. And wherever you are in your understanding of this bill, this law, we are seeing the consequences right now. So it's not about the intent. The intent is everybody gets health care, everybody affords it, and we take care of it, right? We all want that. We want people to have access to the very best health care, period, right? Sounds great. World peace. But we deal with the implementation of this, and that we deal with the results because we're adults, right? Yeah, we're adults, and we have to do that. We also have to deal with the costs. And speaking of the implementation of the Affordable Care Act and the employer mandate that has been suspended, but the individual mandate has not, there was a discussion on this week with George Stephanopoulos yesterday with Republican Congressman Klein engaging in a debate with discussion with George Will and Cokie Roberts. Here's George Will, Klein, and Roberts discussing the announcement last week. Roll it.
The Obamacare requires for it to work mass irrationality, both on the part of employers to ignore that incentive, and on the part of young people who are supposed to pay 3, 4, 5 times more for health insurance than it would cost them to just pay the fine and ignore it.
Look, you have even Democrats saying that implementing Obamacare has the potential to be a train wreck. Well, now you have the prospect of a slow-motion train wreck. And here's the thing about this particular provision. This affects thousands of workers, maybe, not the millions of workers who are going to be impacted over the long haul on this. So if you couldn't even get this piece of it right after a 3-year ramp-up period, you're saying you need another 1.5 years just to put in this tiny slice of Obamacare?
Oh, but it's not a tiny slice. This is huge. I mean, employer mandates are by far the toughest part of it.
it's the toughest to implement, but it's by no means the most complicated in terms of getting
But it was going to
individuals
affect
involved.
more, I mean, every employer because the paperwork requirements.
Right, and who's going to, and who is enforcing it? That's the other big question. And at the moment, apparently, nobody.
You'd think that you would have this conversation possibly before you passed it, but remember, we are going to pass and then find out what's going to be in it. And this is the consequence when you have a juvenile approach to passing law, major law that impacts 16% of the economy. There are consequences to it. What bothers me is the people who pass it keep going back to the intent, like we're sitting there and just a bunch of breathers going, oh, you told me what you want. Okay, it wants to help people. And if I don't support this, it doesn't help people. And I hate grandma, and I hate people who don't have insurance. And if I don't support it, that's what it's going to be, because I, in essence, just want the very wealthy to pass everything, have everything, and I'm heartless. I have no compassion, because the only way this can be done is through government, and it's actually the camel's nose under the tent for a single-payer system. But I digress. Why am I using digress? I don't even know what it means. Oh, gosh. They think that's what they think of us. That's what they think of us. And that's what has happened. They think we're going to get so focused on the intent where we can all agree we can improve the healthcare system, and we can have a debate, and once we get a true consensus, one can pass the legislation. That's how it's done. You get the support, you convince the people, you have the discussion, go back and forth. It takes a while, but you get it done that way because you can weed out a whole host of things. It's challenged. You don't have so-called ripping summits with 2-to-1 ratio, president moderating between the Democrats and the Republicans. Gee, that's going to be real fair. President, Minister of Fairness himself. Remember that joke? That was ridiculous. I mean, come on. Really? We'll suspend it. Oh, it's a brilliant move politically. Ooh, he's brilliant. He may be brilliant. He may have a really high IQ. I don't know. But his policies are absolutely asinine. And they're destructive. Stop pointing your finger. You sound angry, Crane. Well, I don't want you to think I'm characterizing people I disagree with like Chris Hayes does on MSNBC. What? Yeah, MSNBC. They have Chris Hayes. Have you heard him? Roll it.
If you were to sketch the worst caricature of a Republican, you describe him as maniacally obsessed with destroying Barack Obama and cruelly indifferent to the lives of the non-rich. Cartoonish villain who wants to dash people's hopes of finally getting affordable health insurance purely out of spite. And yet here we are, with Republicans in 21 states and 6 still up in the air, looking to deny low-income residents federally funded health coverage. It's not just at the state level. In the Senate, Mitch McConnell and John Cornyn are sending letters to professional sports leagues like the NFL and NASCAR, telling them not to cooperate with any promotion about upcoming health care implementation, warning the leagues against taking sides on Obamacare. We are seeing an entire national party dedicated to a form of sabotage, the intent of which is to make sure that the ordinary working people have a hard time getting health insurance. That's it. I mean, think about how perverse that is. We're the Republican Party, and we're here to break things. But they're not just playing politics. They are playing with people's lives.
Oh, thin ice. Not a lot of facts in there, and a complete miss on what we have been talking about, which is he's talking about the intent. Other people are looking at the result of what actually happens. And you deal with rationing. This is what happens. I want world peace. I want. I get it. Okay, go play. All right, because the adults have to have a conversation here. We have to work out how this works and what actually happens when the government gets involved in a market and artificially imposes price controls. Oh, people leave and people don't want to be doctors, and we have less doctors and more patients. And what does that do? It increases. And what happens to that? Yeah, there are problems with the healthcare system, obviously. It's never really been a free market. But the way to eliminate those problems is to get back to a direct relationship between the consumer and provider. And it doesn't take a Rip and Einstein. You understand this. Chris Hayes has to go back to these infantile arguments of they just don't like middle-class people. They don't like poor people. They don't. And I'm not here about the R's. I'm here about the ridiculous things that are used to defend this terrible law that's hurting everybody. Not about R's or D's, it's about accountability. And when you don't have a case to make, you smear. And you make up cartoonish caricatures of your ideological opposition. And that hurts America if it's not exposed. But it is. Praying Durham's nothing but truth. Live with honor in your life, compassion in your heart. Always keep the faith in Jesus Christ. We'll see you next time. AFR Talk.